This practical mainly revolves around the muscles and the nerve supply to these muscles of the hind limb, but we also do the diaphragm and the nerve supply to it, and we do the nerves that run through the thorax, including the sympathetic chain and the vagus nerve, in other words, the autonomic nerves. I'm going to start with the hind limb muscles. And as in the front limb, we've got muscles that protract the leg and also muscles that retract it. They are not muscles that cause abduction, but there is a very potent adductor muscle. So let's start with the muscles that cause flexion of the hip. Tensor fasciae latae, then the rectus femoris part, that one, it is only that component of the quadriceps femoris, and then on the inside, the iliopsoas muscle, which we can also see a part of there. So these are the flexor muscles of the hip joint. Then the extensor muscles of the hip joint have the precondition that the leg must take weight, because the muscles that act on the stifle and on the hind limb to cause retraction are inserted distal to the tibia's proximal end. And therefore, if the leg doesn't take weight, it would rather cause flexion of the stifle joint. So let's take it as the animal is taking weight. And then we've got the gluteobiceps muscle here. That is also a component of it, and we can see the difference between a red and a white muscle. Then that is the semitendinosus, and that one the semimembranosus. The semimembranosus is fused to the adductor muscle, so it is actually at least two muscles on that side. So when these muscles here, the semimem and semitend contract, and the gluteobiceps, inserting at that level, it would cause retraction of the leg when the leg is taking weight. When the leg is not taking weight, it would cause flexion of the stifle joint. Then with regards to the hock joint, the hock joint has its extensors, in other words, these muscles here at the back, mainly then the gastrocnemius one, and there's a lateral and a medial head. Ignore that one for the time being, because that is a superficial digital flexor. So when this gastrocnemius contracts, it would cause extension of the hock. The antagonistic muscles on the cranial side of the tibia is this peroneus tertius. So between these two, we've got extension of the hock and flexion of the hock. Then we've got the extensors for the digits. The extensors on the cranial side and the flexors on that side, they individually cause extension or flexion of the digits, as the case may be. We can do the nerve supply now. The nerve supply to the hind limb comes from L4 to S3 or 4, depending on the number of sacral vertebrae that are fused. So they divide into a few main nerves. The femoral nerve is the most cranial one, and we can see the femoral nerve there. And the femoral nerve supplies the iliopsoas muscle as well as the quadriceps femoris muscle. Then the next big nerve is the ischiadic nerve, which runs caudal to the hip joint. And I will try to show it there. There's the ischiadic nerve. And the ischiadic nerve supplies the gluteus muscle here. And I think I missed the gluteus muscle when I discussed the muscles earlier on. And then on its way down, the ischiadic splits into two main branches, which is best to see them from here. The one branch, this one here, is the peroneus, and the peroneus supplies the flexors of the hock. The tibialis is the other one, and the tibialis supplies the gastrocnemius muscles as well as the superficial digital flexor. So that is all the nerves then of the hind limb. We will discuss the pudendus nerve and the Pavini nerve when we do the lumbosacral plexus. While we've got a view from caudal end there we can see the obturator internus there and the caudal end of the sacrotuberal ligament. The adductors on the inside, over and above the adductor that is fused to the semimembranosus, is this gracilis muscle, which forms part of that then. The abdominal muscles consist out of the external abdominal oblique, which takes origin here from the costal arch and the ribs, and the direction of the fibers is in that direction obliquely. Then deep to the external abdominal oblique is the internal abdominal oblique, which takes origin there from the tuber coxa, and the direction of the fibers is in that direction. So if the external oblique is in that direction, the fibers of the internal oblique is like that. And then the third one is the transverse abdominis, whose fibers runs vertically. And we'll have to do video recordings on this side and the other side because of the nerve supply. We can see there's one lumbar nerve coming out of the lumbar region, and these nerves that run segmentally supply all the abdominal muscles. If we go to the other side now and we take a video recording there, then we can maybe perhaps see that better, as well as the fourth abdominal muscle. The abdominal muscles on the left-hand side, I'll repeat it. External abdominal oblique, you can perhaps see the direction of the fibers. Internal abdominal oblique, 90 degrees to that, and it lies deeper. Then running vertically, the transverse abdominis, and we can see some more of the lumbar nerves that supply the abdominal muscles. Then, if I reflect this, we can see the rectus abdominis muscle, which is segmented, and it's because it comes out of quite a few somites from the embryo, and that runs longitudinally, and its position, as you can see, is between the aponeurosis of the external abdominal oblique and the aponeurosis of the internal and transverse abdominis. It runs sort of in a sheath. The ligamentum nuchae is a specialization of the deep fascia in the neck region, and the ligamentum nuchae consists purely out of pure elastic tissue. It consists out of a paired funicular part and a paired lamellar part, and it inserts then on the skull, and on this side it takes origin from the spinous process of the thoracic vertebrae, and it even continues further. It serves as a passive support for the neck and the head. This part of the dissection shows the nerves which runs through the thorax, and let's start with the nerve that supplies the diaphragm. This is the right phrenic nerve. It runs medial to the ribs, that's where it enters, and then it runs in the plica vena cava. There's the plica of the vena cava, and it supplies the right half of the diaphragm. Origin is from C5, C6, and C7, but there is some variation in the animals. The pathway of the phrenic nerve on that side is different, and we will do that when we video on the left-hand side. Then while we've got this here, in this view, we can look at the vagus nerve, which runs next to the common carotid artery in the neck region. Then it also dips in medial to the first rib. And then you can see there it runs, and it splits a dorsal and a ventral branch. The dorsal and ventral branch runs dorsal and ventral to the esophagus, and the two branches then pierces the aortus esophagus to supply the gastrointestinal tract. On its way down, it also gives the recurrent laryngeal nerve, which on the right-hand side comes from the subclavian artery, which we cannot see here, and on the left-hand side around the aorta. Obviously, there are also branches from the vagus, parasympathetic branches, to the heart and the lungs. On the left-hand side, the pathway of the phrenic nerve, the left phrenic nerve, is slightly different, although it also runs over the heart, that is in the middle mediastinum, and then in the caudal mediastinum, well, it runs in the caudal mediastinum, which is different to the right-hand side where it runs in the plica vena cava. With regards to the vagus, same story here. It runs next to the common carotid artery, and then it splits here, and it forms a branch around the aorta, which I couldn't see on my dissection, and then the dorsal and the ventral branch, dorsal and ventral, to the esophagus. Then the sympathetic or the autonomic nervous system has got these branches here, which if we can zoom in close enough, I'll just lift that up because that is the stellate ganglion part that I've got there in the forceps, because that is the position where it should be. And it's got two branches. That is the ansa subclavia going around the subclavian artery, and then that branch joins the vagus in that position. Then the continuation of the sympathetic chain, it may be better if we put the carcass down and get better light to see the sympathetic chain continuation before it exits the thorax through the arcus lumbocostalis. In this view on the left-hand side, with perhaps a little bit better view, we can have a retake on the stellate ganglion here, which I showed previously. And the place where I cut it off from the continuation of the sympathetic chain is there, and we can see the sympathetic chain nerve going all the way backwards. That is part then of the autonomic nervous system, and the sympathetic chain has a thoracolumbar outflow. In other words, from the lateral horn of the spinal cord, we get the branches that form the sympathetic chain with ganglia at each segment. And then from the stellate ganglion, there are branches to the heart, to the front limb, and so on. And then the continuation caudally continues through the arcus lumbocostalis, and then it supplies the abdominal viscera.